First aid is a set of basic skills that anyone can learn. If someone is able to do first aid, they have a set of skills that range from being able to deal with someone who has fainted or bandage up an injured body part to potentially saving someone's life who suffered a cardiac arrest. It really is something that anyone can learn.
So first aid is a basic set of skills I think at its core is aimed to maintain life. But aside from that, you could also help with someone with a minor injury, or you could assist medical crews such as paramedics, nurses or doctors with their work.
First aid is important because you never know when someone might have an accident, and you having first aid knowledge can literally be the difference between life and death. Even small things, like someone choking on some food or fainting, having first aid knowledge means you know what to do and don't just panic.
I think first aid is important because you can save a life, but it's also important for yourself because it could give you confidence in a potentially difficult situation.
By helping someone in those vital minutes before help arrives, you aid the chain of survival. The quicker first aid is provided, the better the chance of recovery. Statistics show that only about 10% of people who suffer a cardiac arrest outside of hospitals survive. However, that increases to 40% if CPR is started within 2 minutes, a defibrillator is attached to the chest within 4 minutes, and a paramedic arrives within 8 minutes.
I'm a volunteer first aider with St Andrew's First Aid. I regularly volunteer to provide first aid cover at local events in the community and sometimes citywide and national events. We also occasionally have first aid demonstrations where we can teach people from the public aspects of first aid.
I have trained with the St John Ambulance while at school and First Aid Africa while at university. I think it's a vital skill that everyone should have, and also I find it inherently interesting.
I wanted to learn first aid because I was introduced to it as a scout. Following this, I got a job at the SECC in Glasgow as a first aider where I've continued to work doing first aid.
Covering events for St Andrew's First Aid means that I have to use my first aid skills all the time. However, there have also been a few instances where I've had to use it just out in the public. Most recently, I witnessed a guy fall in the street and go into a seizure. Luckily for us, there was a few of us around who knew how to do first aid, and we were able to keep the guy safe until the ambulance arrived.
I've never had to give CPR yet, although my brother once had to ring an ambulance for my dad, who he thought may be having a heart attack, and I had to quickly perform a primary survey and in my head run through the steps I would have to take to be able to perform CPR if he ended up needing it. Thankfully, he was fine.
I call my first aid skills all the time. In work, I see things every other day, from a dislocated shoulder to someone having a nosebleed. Outside work, I've luckily not needed to use first aid, but it's nice to know what to do in case something serious really did happen.
The recovery position is a safe position for the breathing but unconscious adult. Remove glasses from the casualty's face and any sharp, bulky objects from their pockets, such as mobile phones, keys, or wallets. With the casualty on their back and both legs straight, place the arm nearest to you at a 90-degree angle to their body with their palm facing up. Take the other arm over the casualty's chest and place the back of their hand against the cheek closest to you. Take the leg furthest away from you with your other hand, holding just above the knee, and pull the leg up whilst keeping the sole of the foot on the ground. With the casualty's hand still on their cheek, bring the far leg towards you until the casualty has rolled onto their side. Ensure the raised leg is bent at 90 degrees, in line with their hip. Ensure the casualty's airway remains open by tilting their head back. Place one hand on their forehead and 2 fingers of the other hand under their chin. Tilt the head back gently. Finally, now the casualty is successfully in the recovery position. Ensure emergency help has been called and monitor the casualty until they arrive. After 30 minutes, if help has still not arrived, place the casualty on their other side.
Danger. Check the area for danger. If it is safe to do so, approach the casualty. If not, then phone emergency services and wait where you are for help. Response. Check to see if the casualty responds to simple verbal and physical stimuli. Gently shake the casualty by the shoulders whilst asking a question in each ear.
Hello, hello. Can you hear me?
Is there a response? Yes. If there are no life-threatening injuries at this point, leave the casualty in their current position and summon help. If there is no response, move on to the next step. This is the airway. Airway. The next step is to check and open the casualty's airway. To open the airway, perform the head tilt chin lift manoeuvre. Place one hand on their forehead and 2 fingers of the other hand under their chin. Gently tilt the head backwards and lift the chin up. Remember, always be gentle and consider the possibility of a spinal injury. Breathing. Look, listen and feel for signs of breathing. Look for the chest rising and falling. Listen for breath sounds. Feel for breath on your cheek. Place one ear over the casualty's mouth to listen for breathing. At the same time, look towards the casualty's chest to see if it is rising and falling. You may also feel any breath from the casualty on the side of your face. Agonal breathing can sound like gurgling, and this is not normal breathing. This is a common feature after a cardiac arrest, so do not mistake this for normal breathing. Is the casualty breathing normally? Yes. If there are no life-threatening injuries, move on to assess circulation. No. Shout for help and ask them to call 999 and find an AED. Immediately start CPR, and if you are alone, make the call yourself. Circulation. Is the casualty obviously bleeding? Yes. Try to control the bleed if possible and call 999 for emergency help. No. If you are confident all life-threatening injuries have been dealt with, then reassure your casualty, call 999 and wait until help arrives. Ensure you have performed Dr. AB to confirm the casualty is not breathing. Shout for help and request they ring 999 explaining both the situation and location. After they have called emergency services, get the helper to retrieve an AED.
Help. Can someone help me, please?
Is everything okay?
This person's not breathing. Can you please phone 999 and ask for an ambulance and go get an AED? We'll start CPR.
Step 1. Place the heel of one hand directly between the 2 nipples. Place the other hand over the top whilst interlocking the fingers. Keep the heel of your hand pressed down and your fingers raised. Step 2. Lean directly over the casualty with the arms locked straight. Push straight down towards the breastbone with the heel of your hand to begin chest compressions. After each compression, release pressure whilst keeping your hands on the casualty's chest, letting the chest return to its normal position before the next compression. Compression should be performed at a rate of 100 to 120 beats per minute. This can be achieved by singing the song Staying Alive in your head. Chest compression should be performed 30 times in a row at a depth of 5 to 6 centimeters. This requires some force and ribs can be broken. Step 3. After 30 chest compressions have been completed, perform 2 rescue breaths. Perform the head tilt chin lift and pinch the casualty's nose using the hand from the forehead. Create a seal around the mouth and blow whilst watching the chest rise for 2 breaths. A complete rescue breath should take 1 second. If the chest doesn't rise, ensure a tight seal and the airway is open by adjusting their head position. Step 4. Continue the cycle of 30 compressions to 2 rescue breaths until either emergency help arrives, you are too exhausted to carry on, or the casualty starts to breathe. If there are other people available to help you, they should take turns to perform CPR every 1 to 2 minutes. If an AED becomes available, it should be used immediately, even if you are in the middle of chest compressions. Step 5. Open up the AED and read the instructions. Ensure casualty's chest is exposed and dry. Switch on AED and remove pads from their packaging. Remove the paper on the back of the pads and place them in the positions shown. One pad is placed beneath the collarbone on the right side of the casualty, and the other is placed slightly lower on the left side. Stand clear and make sure no one is stood near the casualty, as you will get shocked. Follow the vocal or visual prompts given by the device to shock the casualty.
Shock advised. Deliver shock now. Press the orange button now. Shock delivered. Start CPR.
After the shock, immediately return to CPR, performing for 2 minutes and then shocking again. Repeat this until the emergency help arrives or the casualty begins to breathe. CPR key points. Call for help. Get your help to call 999 and retrieve an AED. Remember 30 compressions to 2 rescue breaths with a depth of 5 to 6 centimetres and a rate of 100 to 120 beats per minute. Change person every 1 to 2 minutes if possible and stop when you are exhausted. As soon as an AED is available, use it.